And this morning, we know you still have a lot of questions about COVID-19 and Texas. So joining us with some answers is Dr. John Hellerstedt, the Commissioner of the Texas Department of State Health Services. Good morning, Doctor. That story we just shared was from a family whose mother died of COVID-19. They say she could not get a test for the disease for 2 weeks. How big of a problem is this still, and when are things going to change in Texas?
Good morning, Tom. We are increasing our capacity to do testing every day. So the capacity we have today is much larger than it was 2 weeks ago. I would remind folks, though, that we do advise folks, if they're doing okay, to stay at home if they feel ill. A physician can order a COVID-19 test for a person if they believe that the individual has COVID-19. So this is a very tragic case, and I understand the family's grief, but all I can offer is that we are increasing our capacity to do testing, and every day we do more and more.
All right. Now, the latest numbers show that Texas has conducted over 96,000 tests, about one test for every 298 Texans. Now, our neighbors in New Mexico, they've conducted a test for every 88 people. Obviously, that's a much smaller state, but still, why is there such a big disparity there?
I think the disparity does have to do with the population. We have a very large population in Texas, and so it's going to be difficult given that testing capacity still is not, if you will, universally available. It's difficult to increase and get to those kind of ratios. It's a much smaller population in New Mexico and much more concentrated in a few urban areas.
Now, if you have something like flu symptoms, so there's some signs there, you've tested negative for the flu, when do you think Texas will have enough tests where we could get to the point that somebody like that could get tested?
Well, again, right now, the largest capacity is through commercial laboratories. So if a person has a physician and they consult with the physician believes that they should be tested, they can order that testing and that can be performed.
And yesterday we learned about these new CDC guidelines for essential workers saying they can return to work even if they've been exposed as long as they are asymptomatic. What do you make of that recommendation?
Well, again, that's a CDC recommendation, and we try to follow those recommendations here at the state. The recommendation I'm most familiar with, again, it would be in a healthcare setting where those healthcare workers can actually take precautions like wearing medical grade masks and gloves and things of that nature to help protect them from any potential for asymptomatic spread of the virus. We are in a situation where we want to try and balance the social distancing with the fact that we do want people in essential jobs to go to work so that we have food on the table and the electrical system is working, we have power and the like. So it is a balancing necessity. But for most people, if they're not in those essential jobs, they can stay home. If they can work from home, that's great. It increases social distancing. And all of those things decrease the rate at which the disease spreads. And that's really our goal, is to, if you will, let up off the gas, begin to slow down the spread of COVID-19 in our communities. And so we need to do that and balance that with the fact that we do have people who have essential jobs that are essential to support the rest of us in society.
All right, Dr. Hellerstedt, we know you're a busy man. We appreciate you taking some time to talk with us this morning.
My pleasure.